Good morning, good afternoon, good evening. My name is Rich Clark and I've been a hypnotherapist for the last 8 years and I've been a hypnotic therapist for the last 14 years. So as I carry on the Friday Fears and Phobias series, a series about the top 100 phobias in the world, how much a therapy such as hypnotherapy helps cure them. So this one is the fear of death phobia called Thantophobia, and it is number 12 in the top 100. So the Thanatophobia is the extreme and often irrational form of fear and death that leads to the phobia known as Thanatophobia. Very severe cases of Thanatophobia often negatively impact the day-to-day functioning of the individual suffering from this condition. Often they refuse to leave the home owing to this fear. The talk or thought of death, or what lies after death, can trigger panic attacks in the patients. Thanatophobia is also known by various other names such as fear of entombment, or the fear of being buried, dying phobia, fear of cremation, Thanatophobia, or fear of the unknown. Now, I have got a video of fear of the unknown, will be coming up soon, which will be released on the same day. So the cause is fear of death phobia. As in the case with several other kinds of fears and phobias, the fear of death also results from external events, traumatic past, or internalization, predisposition of extreme concepts about death. As children, we learn about death is inevitable and non-predictable. This knowledge can paralyze or overwhelm the person coping with Thanatophobia. Now, sometimes when we're dealing with grief, and I've explained this in a video on Truthful Tuesday about dying and grief from personal experience, that we can sometimes feel that our life, or seeing the life of people we love or live with, can make you alter your respect on life, but also worry about death. It does happen. I'm going to be honest with you, I've never had a fear of death. I believe that when you die, you die. That's it. I think you have an afterlife where you get reincarnated, but I don't fear death as such. Maybe that's stupid sometimes, because sometimes you could be in a situation where you could be facing your death. But I've never had that fear. That's just me personally. But however, I help a lot of people who have a fear of death, and it's quite common after people are dealing with grief or bereavement. So the symptoms of Thanatophobia, the mere mention of death or images or thoughts therefore can trigger a crippling anxiety in the patient. Following emotional, mental and physical symptoms are experienced by Thanatophobic patients. So physical symptoms is dizziness, dry mouth, sweating, palpitations, nausea, stomach pain, trembling, cessation of choking, chest pain or discomfort, hot or cold flushes, numbness and tingling sensations. The mental symptoms, which I think is probably more common, loss of control, feeling of going crazy with automatic or uncontrollable reactions, repetition of gory thoughts, inability to distinguish between reality and unreality, dream-like, I suppose, or fiction. Emotional symptoms, desire to flee and escape from a current situation, extreme avoidance, persistent worrying, terrifying or overwhelming thoughts. Additionally, anger, sadness and guilt may also be present. So the diagnosis and treatment of Thanatophobia is as following. Before considering the diagnosis of the fear of death, it's important to consider a few conditions that are mistaken for Thanatophobia. Depression, ADHD, and bipolar disorders are often linked to this type of phobia. In other cases, undiagnosed conditions like Alzheimer's disease, migraines, concentration disorders, strokes, schizophrenia, and epilepsy may actually be related to Thanatophobia. So the diagnosis of Thanatophobia is best done by the patient themselves. If the extreme thoughts of the fear of death are affecting their lives so much that one is unable to leave the house or compromising upon one's daily functioning, they must discuss this with a medical doctor or a professional practitioner. After ruling out any physical conditions, the doctor might refer the patient to a mental health professional to further evaluate the condition. Many kinds of treatments and therapies are available today to help individuals cope with Thanatophobia. Anti-anxiety medications. Now, disclosure, as yet there are no scientific studies that have proven the efficiency of treating the fear of death phobia. Anxiety medications can also have side effects. Me personally, I wouldn't give anti-anxiety medications, especially for people who have schizophrenia or any form of bipolar. But there are some people who manage it. Yeah? Hypnotherapy, which is what I am. Hypnotherapy is about finding the actual trigger or the problem of why you have a fear of death, and then reframing that, so then when that comes up, then you do not have the fear of the death, or fear of dying, or fear of being in a car, a plane, whatever. Because most fears are actually considered, in some respects, if you've got a fear of snake, then it's actually the fear of dying by bitten by a snake. Fear of a dog, that a dog will attack you. Fear of dying is actually more interlinked with the fears and phobias situation that people associate with, but it's actually interlinked a lot. Religious counselling, some people believe that going to religious counselling would help them. The only issue with that is that it depends on the religion, and if it's a certain, what type of religion is it? Is it too culty? Is it too much their viewpoint of the individual? Whereas like hypnotherapists will actually try and help the patient with their own view and change it to make it that they can live a normal life. That's why I would say hypnotherapy is better than religious counselling, in my opinion. Talk therapy, obviously. Does it work? Bereavement counselling and so forth, fear of death. But there are actually people who go to bereavement counselling and go to grief counsellors and actual groups who actually claim they've actually experienced a death, and they haven't, because they actually like listening to people talking about their death situations. Yes, it's a very weird thing, but there are people who do. NLP and CBT, which again are forms from hypnotherapy, but neuro-linguistic programming is about changing your language. CBT is changing the way the behaviour works towards that, the fear of death. So again, these are all hypnotherapy techniques anyway. Relaxation techniques like imagery, meditation, controlled breathing. Again, that can sometimes help with controlling people's anxiety. So pranayama is very good for that, which I do help people with. Sometimes if someone doesn't want to go into session straight away, I have taught them pranayama techniques for free to help them before they go into sessions with me. It does help. Exposure therapy or regression therapy, which is where the patient is made to relive certain events, analyse them and interpret them correctly. And this one helps resolve surrounding events. So regression therapy is very helpful with that, because again, you could have a fear of being in pain, but that could be from a previous past life. Again, this is again when people believe in this stuff, but it has helped people. I've actually helped many people who didn't ever want to fly, couldn't go flying, and I've actually managed to help them, but they now can go on planes. In fact, some of them never see them anymore because they go travelling all the time. So it does sometimes help. I say sometimes, I think it does really help most of the time, but I'll just to be devil's advocate on that one. Self-help techniques, group therapies with other patients suffering from that. So there is actually a lot of groups with that. And the goal of these therapies is to help the patient pinpoint the exact inciting factor of the fear of death. Therapists, however, help the patient understand why the fear is unfounded and systematically, gradually help the patient cope with these thoughts. That's why a therapist is better, because they're more equipped to reshape it. That's the thing. So it is a very complex phobia, Thantophobia, the fear of death. And if it's left untreated, it can touch every aspect of the individual lives. However, one must not lose hope of the treatments and therapies that can help them cope with it. And the family and friends of these people, it plays a very important in helping the individual deal with the one's fear of death. And within that, also the idea of dying and grief, and then also talking about that if a family member has died with the family, instead of just keeping stum. Keeping stum does not help people, especially with children, and especially with people who are very anxiety or have a fear of a lot of things. They need to be spoken about, whatever that situation is. So there's the fear of death. If you are ever interested in getting over grief or dying, getting over from the fear of dying or the worry of dying, please contact me on my website, or contact me here on YouTube or on social media, and I'll be happy to have a non-obligational consultation with you, and we'll see if we can work it from there. Anyway, until next time, bye.